Hello and welcome. Let's talk about sedatives and hypnotics. So, what are sedatives? These are the agents which reduces anxiety and exerts calming effects. What are hypnotics? Hypnotics are the drugs which produces normal sleep. Now, what is anxiety? Anxiety refers to a pervasive feeling of apprehension. Classification of drugs. Benzodiazepines, which may be short acting like triazolam oxazepam, or intermediate acting like lorazepam, timazepam, alprazolam, midazolam, or long acting like clorazepate, chlordiazepoxide, diazepam, flurazepam, or barbiturates, which include short acting barbiturates like secobarbital, intermediate acting like phenobarbital, and long acting like phenobarbital. Newer drugs like buspirone, zolpidem, zolpidem, eszopiclone, and ramelteone. Others include ethanol chloride hydrate, antihistamine, antipsychotics, antidepressants, and beta blockers. Now, benzodiazepines. These are 1 to 4 benzodiazepine chemical structures and most contains carbamide group in the 7-membered heterocyclic ring structure. Halogen or nitro group in 7th position is responsible for sedative and hypnotic activity. It is well absorbed from GIT and can be given orally. Diazepam, midazolam, and lorazepam can be given intravenously. The elimination half-life is 30 to 200 hours. It can cross the placental barrier. Benzodiazepines are extensively metabolized by hepatic CP450 enzymes, mainly N-dealkylation and aliphatic hydroxylation, which are the active metabolites. Now, mechanism of action. The benzodiazepines bind to GABA receptor in neuronal membranes in the CNS, and this receptor is activated by GABA and function as a chloride ion channel. GABA binds between alpha-1 and beta-2 subunit, and benzodiazepine binds between alpha-1 and gamma-2 subunits and increases the frequency of the GABA-mediated chloride ion channel, opening by enhancing chloride ion channel conductance. Thereby, benzodiazepine produces hyperpolarization of the cell membrane and leads to decrease in the postsynaptic neurotransmission and increases the efficiency of GABAergic synaptic transmission. This is a picture showing the mechanism of action of the BDZ by acting on GABA receptors, GABA neurotransmitters. Now, pharmacological effects. Sedation and anti-anxiety effects. Exerts calming effects with anxiety and causes euphoria and degrade amnesia, impaired judgment, and loss of self-control. Hypnotic effects. Induces sleep by decreasing the latency of sleep onset, increases the duration of the stage 2 sleep, increases total sleep time, decreases REM sleep, and decreases stage 4 slow wave sleep. Anticonvulsant effects may be seen, which inhibits the development and spread of the epileptiform electrical activity in CNS, can control seizure without marked depression of the CNS. And in anesthesia, it produces sedation, anterograde amnesia, and reduces the anxiety, stress, and tension associated with surgical and diagnostic procedure by diazepam and midazolam. Muscle relaxation. It relaxes contracted voluntary muscle in muscle spasm. Mechanism of action is that it inhibits polysynaptic reflexes, it inhibits internodal transmission, and decreases neuromuscular junction transmission in high doses. In CBS and respiratory system, there is depression of the medullary respiratory center in patients with pulmonary disease. There is no significant effects on CBS. It can depress medullary vasomotor center in high doses and in patients with heart failure or hypovolemia. Tolerance, psychological and physiological dependence may be seen. Now, clinical uses for anxiety disorders and for sedation, in case of insomnia, and for pre-anesthetic medication. Also used for general anesthesia, for convulsion, for muscle relaxation, for alcohol withdrawal state, and also treatment in psychiatry for usually major depressive disorder. Adverse effects. Direct effects include, this is the most common direct adverse effect. These include depression of CNS, drowsiness, excessive sedation, impaired judgment, diminished motor coordination. Hypersensitivity like skin rash, which is less common, and tolerance, dependence, withdrawal symptoms may be seen in case of long-term use, and withdrawal symptoms may be seen like restlessness, anxiety, weakness, orthostatic hypotension, hyperactive reflexes, generalized seizure, and cross tolerance and cross dependence may be seen, and teratogenicity also may occur. Now, treatment of benzodiazepine toxicity. Symptomatic treatment is done with mechanical ventilator or maintenance of the plasma volume, renal output, and cardiac function. Flumazenil is a selective competitive reversible antagonist and blocks action of the benzodiazepine, and it is intravenously given. Inverse agonists like beta carbolines, harmine, and harmaline can be used. Now, drug interactions. Alcohol, older sedative hypnotics, opioid analgesics, anticonvulsants, phenothiazine, antihistamine, and tricyclic antidepressants. And benzodiazepines in pregnancy should be avoided because it can cause cardiac dysrhythmia, muscle hypertension, and poor suckling in newborn. Now, advantages of benzodiazepines over barbiturates. It has high safety margin, so it has relatively high therapeutic index. It is more selective in their action. It has less CNS depressant action. It has the least alteration of the sleep patterns, and it does not induce CP450 enzymes, and there is less physical dependence. There is minor withdrawal symptoms, hangover is less and less side effects, and antidote is available, which is flumazenil. Now, disadvantages of benzodiazepines: retrograde amnesia, tolerance, dependence, withdrawal symptoms, formation of active metabolites, higher cost, additive CNS effects with other drugs like ethanol. Now, buspirone. It has selective anxiolytic effects, and the advantages includes it has only anxiolytic effects, no hypnotic effects, no sedative effects, no anticonvulsant effects, and muscle relaxation, and affinity for GABA receptor. Minimum abusability, less psychomotor impairment, does not affect driving skill, and not potentiate the CNS depressant effects of the sedative hypnotics, ethanol, and TCA. Disadvantages: cost is high, many active metabolites are present. Now, pharmacological effects: sedation and anti-anxiety effects, hypnotic effects. Pharmacokinetics includes rapidly absorbed when given orally, extensive first-pass metabolism, highly bound to plasma protein, metabolized to active metabolites by oxidation, elimination half-life is 2 to 3 hours, and excreted by kidney. Mechanism of action: partial agonist of serotonin 5-HT1A receptors, and currently thought this mediates its anxiolytic activity. Moderate affinity for dopamine D2 receptor. Clinical uses includes generalized anxiety disorder but not panic disorder, and adverse effects includes tachycardia, palpitation, nervousness, GI distress, paresthesia, and dose-related pupillary constriction. Now, zolpidem. It is unrelated to benzodiazepine. The mechanism of action is that it binds selectively to benzodiazepine 1 receptor, subtype of benzodiazepine receptor, and facilitates GABA-mediated neuronal inhibition. Pharmacokinetics includes it is well absorbed, half-life is 1.5 to 3.5 hours, and rapidly metabolized. It has more selective CNS effects, more effects on sleep pattern, minimum muscle relaxation, less tolerance and dependence, and respiratory depression may occur. Now, zolpidem. It is a new drug. It is orally given with a half-life 1 hour and metabolized in liver to inactive metabolites. It binds to BDZ1 receptor, rapid onset, short duration, less effects on sleep duration. Amnesia is less than diazepam, and tolerance and dependence is not reported. Now, barbiturates. Classification: long-acting like phenobarbital, barbital, methobarbital, and meflobarbital, or immediate acting like betobarbital, cyclobarbital, amylobarbital, pentobarbital, and allobarbital, or short-acting like secobarbital and quinolbarbital, and ultra short-acting like thipental sodium, hexobarbital, methohexitone, thialbarbital, and thiamyl. Now, urea and malonic acid forms barbituric acid. Now, mechanism of action: barbiturates combine with receptors on the GABA channel and facilitates the action of GABA by increasing the duration of the opening of the GABA-gated channel, and directly activates chloride channel opening, and less selective in CNS depression. The redistribution of the drug from CNS to other tissue is seen, and thipental sodium induces CP450 enzymes. Why barbiturates are obsolete and unsuitable as hypnotics? Because of low therapeutic index, non-selective CNS action, more tolerance and dependence, popular social abuse drug, potent enzyme inhibitor, and no antidote is present. End of the topic.